Nursing in Service Training Program. So for today, first I would like to acknowledge uh, our medical director, Dr. Julie Pua Peras, for joining us. And I would like to introduce we are lucky to have our lecturer, speaker for today. And she is the head of our hospital's ICU department, and she is a pulmonologist. So I would like you to welcome our lecturer, Dr. Edelweiss Marine Velasco. So palakpakan muna natin si Doktora.
Thank you, Dr.
So she will
Ra.
discuss about the topic about COVID-19. So there is Dr. Julie Pera. So say hi na lang din po sa natin sa medical director. Okay, Dr. Velasco, okay na po.
Okay. Good afternoon, everyone. So, welcome sa ating lecture today, Coronavirus Disease. Ito ay entitled na Challenges and Consideration. I hope na you can hear me clearly. Kung hindi nyo po marinig masyado, you can chat in your concern here sa chat box. Kung may queries and questions din po kayo, you can directly chat me. Or you can press the reactions, either clap your hands like this or thumbs up to get my attention. Okay? Okay, so let's start. I will unmute, I will mute everyone muna para hindi masyadong maingay. Okay. So later, meron pa mga ibang pumapasok. So kung meron mga pumapasok na hindi ko pa na-admit, just let me know para ma-admit ko sila. I will share my screen to you. Basic. Okay. So yan. Nag-share po ba sa inyo yung screen ko? So, coronavirus disease, COVID-19, challenges and considerations. This is the disease burden and pathogenesis. Okay. So, welcome again. So, coronavirus, as we all know, is an infectious disease caused by severe acute respiratory syndrome, coronavirus 2, or the abbreviation niya, SARS-CoV-2. Okay, yan. Recently discovered novel coronavirus. So, madaming pinagdaanan si coronavirus na COVID-19 na name from nCoV, naging COVID-19. Yeah. So, may mga iba pa siya, novel coronavirus and other name. So, most common pathogen of the upper respiratory tract infection ay yung mga coronaviruses throughout the years, both in adults and in children. Okay? So, before I continue, wait lang ha, kasi baka meron pang participants na mag-join. Ayusin ko lang muna yung setup na. Siya makita. Okay, let's continue. So yan, common pathogen siya na upper respiratory tract infections both sa matanda and bata. And they are responsible for 20% of such infections. Usually, yung course of the disease may last for several days and usually mild lang po yung course niya. Okay? Yeah. So, kung makikita nyo dito sa slide natin, since December 31, this was updated last week, August 25. Sorry, hindi ko na siya na-update. Pero based on the last week updates, ay nasa 23 23,673,902 na po yung cases ng COVID. So most probably, nadagdagan pa ito ng mas marami. Ano po? And yan. Ito yung nationwide cases natin. So ito yung sa atin sa Philippines. This was also last week. So ngayon mas marami na sila. Nasa 200 plus na yung cases. No? Kita nyo ba yung slide natin? So active cases natin is mas mataas na ngayong week na ito as compared to last week. So the etiology and pathogenesis of the coronavirus, first case of unknown etiology appeared sa Wuhan. We all know that, sa China, province of Hubei, early December 2019. And subsequently, previously unknown type of virus was isolated in January 2020, which was originally labeled as novel coronavirus. Ngayon, ang pangalan na niya, as earlier mentioned, SARS-CoV-2. SARS-CoV-2, yan yung severe acute respiratory syndrome coronavirus 2. Kasi yung SARS-CoV na una is yung SARS na nauna na dati. Yung sa Hong Kong. So tandaan nyo yan ha, ang tawag na sa kanya SARS-CoV-2. So for the virological aspect, so currently there are 180 species of RNA viruses that can infect human. Okay? On the average, 2 species are added every year. And about almost 90% of human infection are considered zoonotic, and many of the remainder have zoonotic origins. Okay? So there are different types of coronaviruses, the alpha, the beta, the gamma, and the delta. Okay? The SARS-CoV-2 belongs to the beta coronavirus. Okay? So it's a positive sense, single-stranded RNA virus of spherical shape. So it suggests that this is a beta coronavirus closely linked to SARS virus. So it has a S protein, yung spike protein located on its surface and below, which form pronounced projections. Kaya nga di ba nakikita natin yung mga picture ni coronavirus is like a ball na meron siyang parang mga crowns, mga spicules, spikes on its surface. So they created an image reminiscent of a solar corona. So taxonomically, the virus belongs to order Nidovirales, the family of Coronaviridae, subfamily group of Orthocoronavirinae. Yeah. So the host and reservoir, usually wild animals, bats or mga bats are the most possible host of the novel coronavirus. And the transmission is directly from bats through an intermediate host. So pwedeng bats ang pinagsimulan, pero pwede pa yung intermediate host. So ngayon meron na tayong human-to-human transmission. Kaya siya zoonotic transmission ang pattern. So we'll go now to the duration of infectivity. So it is important for everyone to know the duration of infectivity. Kasi dito sasalalay kung kailan mo i-observe yung sarili mo, kailan mo i-classify yung patient mo as to infectious, non-infectious, and in the recovery period. So, yeah. The incubation period for COVID-19 is the time between exposure to the virus, becoming infected, and the symptom onset. So, ibig sabihin, ito yung time na na-expose ka dun kay coronavirus hanggang dun sa magkaroon ka ng first symptoms. For example, nag-handle ka ng patient na August 24, nagka-symptom ka na August 30. So, ilang days yon? 24, 25, 26, 27, 28, 29, 30. 7 days. So, ibig sabihin, ang incubation period mo is 6 to 7 days. So, kaya ang average niya is 6.4 days from 2 to 11 days. So, pwedeng magkaroon ng incubation period as long as 11 days. So, ibig sabihin, kahit na expose ka ng August 24, pwedeng wala kang symptoms for 11 days. Yun yung incubation period ni COVID-19. Okay? To ensure a safe duration of quarantine, it is reasonable to assume the incubation time between 2.4 and 15.5 days. Si DOH, ginawa niya na 14 days. I-round off na lang niya sa 14 days. Okay? So, yan ay based dun sa ating incubation period. Kung nalampasan mo na si 14 days or sa iba, 15 days, medyo safe na siya na sabihin na non-infected ka. Okay? And non-infectious ka. On the other hand, according to the WHO data, the time to onset of symptom is between 5 to 6 days, but can be up to 40 days. So during this period, also known as the pre-symptomatic period, okay, some infected persons can be contagious from 1 to 3 days before symptom onset. So as early as day 1, pwede na siyang maka-infect ng other person. So an asymptomatic case is a person infected with SARS-CoV-2 who develops or who does not develop symptoms. Okay? Sabihan niyo ako pagka hindi niyo siya masyadong marinig or maintindihan o masyadong mabilis or ang pangit ng salita ni Doktora. Okay? Para I can slow down or I can adjust my audio. Are you still there? Okay. I assume you are still there. So transmissibility of the virus, main infection source are the patients who with pneumonia are infected by the 2019 ECOV. So yung mga patient na may pneumonia, and the main route of transmission is respiratory droplet and direct contact with an infected person. Are these, sabihin natin, these are the main route of transmission. So kung meron tayong direct contact or through respiratory droplet, yan yung main route of transmission. Pero, pwede rin siyang mag-aerosolize during coughing or kung nag-nebulize tayo kay patient or may mga procedure like suctioning, ano pa, yung mga BiPAP or CPAP, high flow na ototherapy can also cause aerosolization, kaya dapat naka-negative pressure ang room ng patient. Okay? Although the source of the virus and its ability to spread between people remain unknown, there are already increasing number of cases which indicate human-to-human transmission. Yesterday, nakita ko doon sa post ni Gob Ramil Hernandez. Nangunguna na po si Kalamba sa transmission. Yeah. Ang cases nila, active cases nila, I think ay 671 na po yung cases. Ang total confirmed sa Kalamba ay 1,665. Sa Bae, there are 30 active cases. Okay? So the transmission mainly occurs from symptomatic people to others by close contact. Kaya kailangan may social distancing tayo. Through respiratory droplets, by direct contact with infected persons, and by contact with contaminated objects and surfaces. So part of infection control, and para hindi rin tayo mahawa and hindi rin tayo makapanghawa is to avoid direct contact or close contact, and consistent na sanitation ng mga gamit natin, hand washing, hand sanitation, and observe the social distancing. Shedding of the SARS-CoV-2 is highest in the upper respiratory tract, sa nose and sa throat, early in the course of the disease. That's why it is important for you to wear your mask properly. So may mga nakikita ko naka-mask nga, naka-face mask, pero hanggang dito lang, hindi na-cover si ilong. Sabi, highest ang shedding sa nose at saka sa throat during the first 3 days of the onset of symptoms. Kaya nga yung mga staff natin, no, kahit na sabihin natin na naka-PPE po tayo, naka-face mask tayo, naka-face shield tayo, no, para rin po protection natin sa ating sarili. Yan. Always, kahit sabihin natin na clean case yan, kasi hindi natin alam, baka mamaya is asymptomatic pa si patient. Yeah. Palagi natin na may naririnig akong voice. Saglit lang. Unmute ko lang siya. Hanapin ko siya. Hindi ko makita. Nawala na. Okay. So, kung meron tayong mga pasyente, especially yung mga nasa orange ward, ICU, pero this should be applied to all wards. No? Dapat yung mga pasyente natin is naka-face mask din sila. And ensure that the face mask is properly placed. Dapat cover ang nose, cover ang mouth. Ito po, diba? Yung surgical face mask, meron siyang parang bakal. Turuan mo yung pasyente i-press para rin yung air leak, hindi na, or yung respiratory droplets ay hindi mag-sip in doon. Okay? So to protect each and every one of us. Kasi sabi is highest ang shedding sa upper respiratory tract. Sabi doon sa incubation period, si asymptomatic patient, pwede na siyang maka-infect. And sabi din dito sa ating epidemiology and virologic study, as early as the first 3 days of onset of symptoms, highest ang infection to the nose and throat. So, mas mag-shed si SARS-CoV-2. Okay? So, i-instruct nyo palagi yung mga pasyente nyo. And of course, tayo rin, ganun din. Kapag nag-rounds tayo, nasa station tayo, wear your PPE properly. No po? Kaya nga ay kanina nag-rounds ako, I check with them dun sa ating supervisor kung ano nangyari dun sa ating pantry, no? Kasi dapat ay meron tayo place na talagang pwedeng dun kumain, hindi sa station. Okay? So, aerosol formation during medical procedures cannot be ignored. Sinabi ko na yan kanina through suctioning, but now we already have the closed system suction. Okay? So that's good. Ang problem lang, paano kung hindi naman intubated si patient? You still have to suction secretions. Diba? So sana wala siya masyadong secretions. Dry cup lang sana si patient to avoid aerosolization. Virus present in the blood and feces of SARS-infected person will also spread in aerosol form. So that's why it is important for those patients na hindi pa sila nakatapos ng quarantine nila, or halimbawa tayo, nag-quarantine tayo because we have some symptoms, dapat talaga yung ating mga blood feces or yung ating mga secretions are handled carefully. Okay? So, in the quarantine facility, the person or the patient should have his own bathroom facility. So, conjunctiva of the eye is the most likely portal of entry for aerosol and fluids. So, it is important to protect your eyes. Kaya nga, ngayon, require na nila ang face shield or eye goggles. Okay? So, the possible route of transmission to newborn positive for coronavirus at birth, born to a positive mother, has not been explained. But studies said that vertical transmission or through close contact may be the possibility of possible route of transmission. Okay? So again, close contact, direct contact with the respiratory droplets. And then the most common or most likely portal of entry is your conjunctiva. May post-test tayo after this, pero next week ko yun ibibigay. Okay? So transmission susceptibility, symptomatic transmission refers to the transmission of SARS-CoV-2 from person with symptoms. The disease affects all age groups. Wala po siyang exemption. But it is more fulminant in the neonates, elderly, and individuals with underlying illnesses. Most susceptible po sila with the SARS-CoV disease. Okay? Usually, sila yung nagkakaroon ng mga severe disease. So the time from infection to death was shorter for patients older than 70 years old as compared to younger patients. And in a study of Wang et al., they demonstrated that the mortality rate of 15% at median age of 49 and 32 patients with comorbidities. So mas higher ang mortality rate dun sa mas matatanda and doon sa may mga comorbidities. Kaya kung mapapansin niyo yung mga nag-handle ng mga COVID patients sa orange ward, yung iba kahit matanda na di-discharge kasi wala naman silang comorbidities. As compared doon sa mga bata na mga diabetic na natalo ng COVID. So it is important talaga na maging aggressive tayo sa pag-handle ng mga patients like mga elderly at yung especially yung may mga comorbidities. So an intensive care unit admission was required for 32% of patients for high flow nasal oxygen therapy or supply of higher concentrations of oxygen. Bakit kailangan sa ICU sila kung naka-high flow nasal oxygen therapy? Kasi kailangan ma-monitor natin si patient kung kaya ba siya ng high flow nasal oxygen therapy lang or kailangan na natin ng mechanical ventilation kay patient. So dapat mas close ang monitoring for those patients that are requiring higher concentrations of oxygen. Kasi mas mabilis sila mag-deteriorate, mas mabilis sila mag-toxic during that time. So clinical syndromes, most common symptoms of infections, fever, 83 to 93%, cough. Wait lang. He's outside. We have a lecture. Come back later. Okay? So most common symptoms, fever, cough, fatigue, anorexia, shortness of breath, and myalgia. The fever, usually, it can last up to 7 days. Minsan, maabot siya ng 2 weeks. Okay? Also, the cough, though the cough may improve, at times, there are some residual cough even the patient has already recovered. The fatigue may stay for several weeks. Kahit na-discharge na si patient, there's still feeling of easy fatigability. Okay? So other non-specific symptoms, sore throat, nasal congestion, headache, diarrhea, nausea and vomiting, loss of smell, or loss of taste. There are some reported cases na aside from headache, ang complaint lang ni patient is dizziness. Nahihilo lang sila. Okay. So, for the they usually present with atypical symptoms. Wala silang fever. Usually they have fatigue or weakness, reduced alertness, reduced mobility. They can have diarrhea, loss of appetite, or delirium. So these atypical symptoms is similar to those elderly patients that have pneumonia. Usually kasi sa elderly, the pneumonia will not manifest as fever and cough. Usually body weakness lang sila. Okay? So for the severity of the disease, 40% presents as mild case, 40% as moderate, 15% presents as severe disease. These are the patients who requires oxygen support, and 5% critical presentation. Which is complicated, such as those that have respiratory failure requiring mechanical ventilation, or those in acute respiratory distress syndrome, sepsis, and septic shock, those patients that has thromboembolism presenting as stroke or pulmonary embolism or acute MI, multi-organ failure, including acute kidney injury and cardiac injury. Okay, so what are the risk factors for the severe disease and death? Risk factors include older age, smoking, those patients with underlying non-communicable diseases such as diabetes, hypertension, cardiac disease, chronic lung disease, and cancer are more vulnerable than those without non-communicable diseases. And patients that are elderly have higher mortality rates as compared to the younger group. So here, ito na yung summary ng risk factors for the severe disease, as I mentioned earlier, and smoking, kung nagsisigarilyo si patient. So there are also mental and neurological manifestations. Not all symptoms pertains to chest and lungs. Okay? Patient may also present with delirium, like the one presented as symptoms observed in elderly and immunosuppressed patients, agitation, stroke. So, hindi porke stroke lang ang presentation ni patient, automatic clean case. Okay? Meningoencephalitis, impaired sense of smell, anxiety. So, common po ang anxiety, depression, and sleep problems. Okay. So, one of the clinical syndrome is the acute respiratory distress syndrome. So, patient may deteriorate with increasing respiratory symptoms at about a week after infection. So, ang complication is SARS-CoV, more common in older people, and those with impaired immunity, and those with comorbidities. Okay? So, severe forms that are indications for ICU treatment. These are the patients that need to be admitted in the ICU. Those with acute pneumonia, which is severe, ARDS, sepsis, and septic shock. Okay? So, dapat alam natin. So, we know how to cohort the patient. Okay? Saan natin ilalagay si patient? Pwede ba siya dito lang sa ward, sa less toxic, mild disease? Or kailangan ilagay natin siya doon sa unit na para ICU setting? Sa ngayon, di pa natin na-activate yung ating ICU COVID. Lahat nasa orange ward pa lang sila. Okay? Pero dapat, alam na natin kung saan sila ilalagay. No? May mga designated unit tayo kung saan ilalagay yung mga dapat bantayan at saka yung hindi masyadong kailangan bantayan. Okay? Syndromes associated with COVID-19. From time to time, chine-check ko kayo kung nandyan po kayo. At least ICU na nakikita ko naman kayo na nakikinig pa kayo. Sabihin nyo lang kung may pa-iced tea ba dyan. Joke lang. So, mild illness. Yan. So, ito na yung mga syndromes associated with COVID-19. So, mild. Kailan natin sasabihin na mild? So, kung si patient, uncomplicated yung upper respiratory tract infection niya, pwede siyang mild symptoms lang like fever, fatigue, cough, pwede may sputum production, pwedeng dry cough, anorexia, malaise, pero stable ang vital signs. Patient may also present with diarrhea, nausea, and vomiting. Okay? And as mentioned earlier, yung mga elderly na nagpe-present as atypical symptoms, headache lang, dizziness, or decrease in appetite. Pregnant women are also vulnerable to COVID-19 infection. Okay? Pwede ang presentation lang nila dyspnea or gastrointestinal symptoms or fatigue. Medyo mahirap siya i-delineate kung yung symptoms ng pregnant women is secondary to the normal pregnancy or secondary to COVID infection. So, kailangan natin yung high suspicion talaga. Okay? Kasi as the mother progress to the term pregnancy, kung mas malapit na siya manganak, mas malaki niya, mas meron siyang chances na maka-experience ng dyspnea and upper GI symptoms like yung mga gastroesophageal reflux, which is common also in pregnancy, and which is also the symptoms in COVID infection, and fatigue. So kung nagbuntis na yung iba dyan sa atin, you know what I'm talking about. Pregnant are experiencing easy fatigability, especially during their birth. Okay? Yeah. Then pneumonia. So adult or adolescent with pneumonia usually presents with fever, cough, dyspnea, fast breathing, but no signs of severe pneumonia. Signs of severe pneumonia are those that have autosaturation of more than 90 on room air and no need for and, sorry, this one, the severe pneumonia, are those patients that do require oxygen. But the pneumonia, the mild or moderate pneumonia, does not need supplemental oxygen. For the children, in-include ko na rin dito ang children who has cough or difficulty of breathing. Ito yung mga babantayan ninyo na respiratory rate nila. So this is important for you, especially those that are monitoring the patients when to refer. Kung less than 2 months at ang RR na ay more than 60, you refer. Kung 2 to 11 months at more than 50 ang respiratory rate ni patient, you refer. For the children 1 to 5 years old, cut-off natin is 40 ang respiratory rate. Okay? So while the diagnosis can be made on clinical grounds, chest imaging like radiograph, X-ray, CT scan, ultrasound may assist in the diagnosis and identify or exclude pulmonary complications. Okay? So for the severe pneumonia sa adult and adolescent, usually they present with fever and suspected respiratory infection plus one of the following. So kahit isa lang dito. Kung ang respiratory rate niya is more than 30 or meron siyang severe respiratory distress, makikita mo yung mga usage ng accessory muscles ni patient, may either flaring or may supraclavicular na use ng muscle niya. Okay? Or yung O2 saturation niya is less than 90% on room air, then we can classify the patient as severe pneumonia. So this one, as mentioned earlier, we should admit this patient to the ICU setting for close monitoring. Okay? So for the children, okay, with severe pneumonia, with cough or difficulty in breathing, plus at least one of the following. Kung meron na silang central cyanosis, so same lang yung auto-saturation cutoff nila, less than 90% can be categorized as severe pneumonia in children. Severe respiratory distress, so by observing the child, if may grunting, very severe chest indrawing, and signs of pneumonia in general danger sign, inability to breastfeed or drink, lethargy, unconsciousness, or convulsion. So, yeah, severe na yan. Okay? So, other signs of pneumonia, chest indrawing, ito na yung na-mention natin kanina. Okay. While the oxygenation impairment in adults is important for us to know kung ilan ba yung PF ratio ni patient para ma-classify natin kung nag-acute respiratory distress syndrome na ba siya. So how do you get the PF ratio? You get the arterial oxygenation, i-divide mo siya sa FiO2, yung sa present support na oxygen ni patient. Okay? So we can categorize the patient as acute respiratory distress syndrome if they have bilateral infiltrates on chest X-ray, excluding the cardiac diagnosis, plus decreasing PF ratio. So mild ARDS kung less than or equivalent to 200 millimeters mercury yung kanilang PF ratio. But if the patient is ventilated with a PEEP or CPAP of 5 cm water, so kung less than 300 siya, papatak siya ng mild ARDS. Okay? For moderate ARDS, kung magpapatak na siya ng 100 millimeters mercury ang PF ratio niya, and for severe, less than 100 millimeters mercury. Dali lang naman tandaan, diba? Severe, less than 100. Moderate, nasa 100 siya. Mild, 200 and above po siya. Okay? When PaO2 is not available, we can use the SpO2. Yun yung O2 saturation na nami-measure natin sa PLET. 97, 90% na O2 saturation. Okay? So, yung PaO2 pala, sa EBG nyo yan makukuha. Yeah. PaO2, di ba? pH, PaO2, bicarbonate, PCO2, tapos yung O2 bicarbonate yan. So, yung PaO2 by ABG yan. Yung SpO2, ito yung sa PLET. Okay? Pulse oximeter. Okay? So, COVID also can present as sepsis in adult, which is a life-threatening organ dysfunction caused by dysregulated host response to suspected or proven infection. So, signs of organ dysfunction include altered mental status, difficulty of breathing, low oxygen saturation, reduced urine output, fast heart rate, weak pulse, low blood pressure. So, usually sepsis ang presentation kung meron siya nitong mga to. And laboratory evidence of coagulopathy, thrombocytopenia, acidosis, high lactate, and hyperbilirubinemia. Okay? So, septic shock, ibig sabihin, in shock na si patient kung ang blood pressure ni patient is requiring already na vasopressors. Yun yung mga dopamine ninyo, dobutamine, norepinephrine. Okay, so map of more than 65 millimeters mercury and serum lactate level of more than 2 millimoles per liter. Yan yung ating identification na nag-sepsis na or nag-septic shock si patient. Dapat ay itong level na ito ay ma-achieve natin so that we can pull out the patient out of sepsis. Okay? Children with septic shock are classified for those with any hypotension. Okay? So, below ng 5th percentile or more than 2 standard deviation below normal for age. Okay? So, halos similar lang din ang presentation niya with the adults, yung mga symptoms. Okay? That's the end of my lecture for the COVID. Di ko na sinama dito yung computation ng ROX index. So probably we can include yan sa oxygenation. Okay? At yung PF ratio, alam na naman natin na i-compute. Do you have question with regards to the COVID-19? Tapos yung lecture po para dyan. Hello, are you still there? So again, clear po. In summary, I presented sa inyo yung taxonomy ni coronavirus SARS-CoV-2. Okay. Yung clinical manifestation, the incubation period, and the clinical syndromes, and the risk factors. So this is important for us. One is to cohort the patient, and secondly is, especially sa mga nurses natin, is to classify yung patient natin as to mild pneumonia, severe pneumonia, critical. So it is important for us to identify our patients and yung level of infectivity nila. Okay? So again, sabi natin is 2.4 to ilang days nga? 15.5 days yung incubation period by WHO. Okay? So that's summarize my lecture for this afternoon. I hope you learn something. Do you have question? You can unmute your audio. Hello, Sir Andrew.
Ayan po, Doktora.
Okay.
Baka may mga
May
questions
question.
kayo. Ay, ikaw
Doktora, paano po yung pagpe-prepare po namin para sa sarili po namin
Sorry ha,
about sa COVID po?
hindi ko masyado naintindihan. Anong sabi mo?
Doktora,
Identify
yung question
yourself
po ng isa
first.
natin,
Ha?
ang question daw po niya, so ito, kilala ka din mo sa ICU.
Sa ICU po kasi kami mapapa-assign, Doktora.
Okay.
Paano po kami magpe-prepare? Opo. Magpe-prepare po para sa sarili po namin. Physical health po, Doktora.
Physical health.
Ayan, Doktora, yung po nagtanong natin is bagong ma-assign po sa ICU.
Okay. So,
Ang
physical
question po
health.
niya, Doktora,
Paano magpiprepare?
ano daw po masasuggest niyo para physically ready sila sa mga challenges to take care of COVID patient in the ICU po?
First and foremost, respiratory tract infection usually mas madaling maapektuhan kung lagi kang puyat. Ibig sabihin, kulang tulog mo, sobrang pagod ka. So, hindi naman 24 hours ang duty ni nurse, diba? May shifting. So, kung off-duty ka, take time to rest talaga. Mag-rest ka. Matulog ka. Kung hindi ka makatulog, at least magpahinga ka. Yung mga ibang gawain sa bahay siguro is i-delegate sa iba. No? It might be very difficult to do, especially kung nanay ka, may mga baby sa bahay, dahil gusto nila makapaglaro sa'yo. But still, yung time management, take time to rest. Have an adequate sleep. So by the time na mag-duty ka ulit, ready na yung katawan mo and body system mo for the next battle. Okay? Drink a lot of water. Important yung water. Pero huwag mo naman lunurin ang sarili mo. Baka naman mag-congest ka. No? Ano pa? Vitamins. Hindi kasi ako masyadong mahilig sa vitamins. Pero for some people, it helps. Multivitamins. Try to find yung mga quality na multivitamins. Kung ano ba masasuggest ko na magandang multivitamins? Mosigor Vita, Apibon, pero yung Centrum, Clusibol, at saka hindi ko sila masyadong favorite. Kasi para Enerbon, hindi ko rin masyadong favorite. Mura sila, pero parang yung quality ng vitamins na kaya nila i-deliver is hindi ganun ka-adequate. Siyempre, diet pa rin. Yung mga healthy diet, iwasan na natin yung mga soft drinks, soda. Kasi there are some studies ng soda magpo-cause ng muscle fatigue. Hindi ko matandaan kung saan study. Pero may nabasa kasi akong literatures na pwede siyang mag-cause ng muscle fatigue yung mga soft drinks. Kaya minsan, pakiramdam mo, nalay yung BP mo. Siyempre kung mag-duty ka, tapos parang pakiramdam mo pagod. At saka, lalo na ngayon na most common symptoms din ni COVID is fatigue. So ano pa? Ano pang preparation ang gusto mo? Nag-e-echo. Nasagot ko ba yung mga tanong?
Ano po question, Doktora?
Ano pa? May tanong ka pa? Nasagot ko ba yung katanungan mo kung paano mo ihahanda ang sarili
Opo,
mo?
Doktora. Thank you po. Opo.
By
Thank you
the
po.
way,
Thank you po.
no?
Opo.
Kasi ako nagre-rounds ako, kayo naka-stationary lang kayo sa stations. No? I'm moving from hospital to hospital. Though, hindi ako nakababad sa PPE, pero like for example, sa Global Bay, mag-PPE ako. Floors, palet, PBS, PPE, ICU, PPE. Then, when I go to another hospital, PPE. May time ako to breathe. May time ako para huminga. Although, yung pagod ng mga biyahe, medyo mas maraming biyahe sa akin. So, kayo, walang masyado, kung nag-start ka ng umaga hanggang matapos ang shift mo, naka-PPE ka, hindi ba? Diba, Sir Andrew? From the moment na pumasok sila sa duty nila, naka-PPE sila. Tama po ba?
Hindi ko naman.
Kasi nawawala yung signal. Nakapipili daw po.
Naka-PPE naman po.
Oo. Pagpasok nila, suot nila yung PPE nila from the start hanggang mag-out sila. Pag mag-out na sila sa kanila, huhubarin yung PPE. Am I right?
Apa.
Kailan lang nagtatanggal ng face mask si nurse?
Kailan lang?
Kailan lang tinatanggal ang face mask?
Face mask ba?
Nag-e-echo kasi yung isa ninyo na ano. I-off mo yung speaker nitong isa, yung medical director na speaker.
Sino ba nag-off na speaker noon? Off naman na speaker noon.
Medical director, i-off mo yung speaker niya. Nag-e-echo kasi siya eh. Sa taas eh. May volume yan. Hinaan mo na lang yung volume.
Yan, isipin mo na lang.
Nakita mo? Yung volume hinaan mo lang.
Apa.
Para hindi siya mag-feedback.
Ayan.
Okay. Yan. Naririnig niyo na ako? Malinaw na?
Apa, Doktora.
Oo. Ang tanong ko, kapag ka pumasok, halimbawa ako ang nurse, pumasok ako sa duty ko, sa shift ko, pagpasok ko, magbibisa ko PPE, mask, face shield, then the bunny suit. Kailan lang yung time na aalisin ko yung face mask ko?
Yung face mask. Kailan daw yung time na tinatanggal ng face mask? Wala, pag-uwi na.
Pag-uwi na po.
Pagkakakain lang. Pag-uwi. Pagkakakain, syempre tatanggalin yung face mask, di ba? Wala ba kayong break?
Tapos palit na po ng bago yung mask.
Oo. So, kaya nga sabi ko kay Ma'am Joy, kanina na nag-rounds ako, ay sana mag-materialize na yung ating pantry na kung saan pwedeng kumain ang staff nurse na hindi siya mangangamba na pag tinanggal na yung mask is baka makuha na yung infection doon sa environment. Yung mapoprovide natin yung proper social distancing para naman makahinga tayo. Kasi di ba medyo mainit yung PPE, mainit yung mask. Pag nilagyan mo pa siya ng face shield, halos hindi ka na makahinga. And ideally, no, kung naka-face mask ka, may baon ka na isa pang set ng face mask. After 3 to 4 hours, palitan mo siya para makapahinga yung isa mo face mask. Parang nakabago ka ulit na face mask para mas madali na siyang huminga ulit. Kasi kung i-straight mo ng 8 hours, 12 hours yung ginagamit mong face mask, isa lang siya, at the end of the day, pagod na pagod ka, ang hirap huminga. I-try nyo lang. Ano ba ang gamit nyo na face mask? You can reuse the face mask. Basta hindi siya basang-basa ng laway. Hindi
Okay
siya
po.
marumi. No? So, pwedeng meron kang supot. Bawa, pumasok ka ng umaga, suot mo si face mask. After 4 hours, medyo mahirap lang huminga. Tanggalin mo yung face mask na suot mo, lagay mo sa isang supot, keep mo siya para pwede mo pa siyang gamitin the next day or some other day. Tapos, palit ka ng mask para mas madaling huminga. Try nyo lang kasi mas comfortable kung magpapalit ka ng face mask in between. Kaysa dire-diretso na yung face mask mo, 8 to 12 hours mo siya nasuot. Kasi surgical mask, hanggang 8 hours lang siya, dapat dispose mo na siya. Okay? Ano pa? May question
Baka may
pa?
questions ka daw. Yung mga iba pang nanonood, baka may questions kayo, pwede nyo i-chat si Doktora. I-type ninyo yung questions ninyo.
Huwag na kayo mahiya. Oo. Isisend ko yung kung na-record yung lecture, isisend ko yung lecture, yung link kay Sir Andrew. And yung soft copy ng lecture.
Okay po. So guys, do you have any more questions or clarifications with regards to Dr. Velasco's lecture? Okay
Sir
na.
Andrew, may
Yes,
magle-lecture po
Doktora.
ng infection control.
Yung lecture pa lang po na infection control, yung kay Sir Tilford pa lang po ang nasa amin na naka-plat. Pero po just in case po, pwede rin naman pong sa mga succeeding months po, pwede po tayo maglagay pa po ng mga topics.
Okay, sige. Kasi para sa infection control, maisama natin yung proper use ng mga PPE.
Yes. At Doktora, ano naman po, active naman po yung lecture po natin, including the demo and return demonstration for proper donning and dosing po.
Okay. Sige.
Tapos I have already coordinated with Doktora Pamatmat regarding her lecture. Pumayag na po siya.
Nakita ko yung pinost.
Apo.
Sige, I will try to join
So,
you
ayan.
sa mga lectures na pinost ninyo para kung meron din akong questions. Tanong.
Doktora Velasco, before po tayo mag-end, magbigay lang po ng konting inspirational message and mag-thank you lang po for the words of gratitude ang ating medical director, Dr. Julie Pua Peras. Dr. Peras.
Ayan. Ay, doktora, naka-mute po yung audio niyo po. Sorry. Okay na po, naririnig na po namin. Ay, na-off ulit.
Okay, good afternoon. So, in behalf of the Global Care Medical Center of Bay, we would like to thank our ICU head and our main, parang siya rin yung ating head sa ating training. So, we would like to thank Dr. Velasco for the lecture on COVID-19. So, actually, nakinig din ako at saka nag-notes. Tapos, so for all the nurses, this will just be parang part 1 ng mga series natin. So we will have actually mga series of lecture. And I would also like to take this opportunity pala na to inform everyone na itong mga lectures natin, ginagawa natin to. So inuuna lang natin yung tungkol sa COVID-19 kasi gusto natin na parang you will feel empowered talaga and protected.
Yes.
Kasi sabi nga ni Doktora kanina, di ba? So ang isang panlaban natin sa infection is dapat hindi natin pabayaan yung sarili natin. Kaya wala namang tayo mag-duty ng 24 hours. Saka i-reiterate ko lang na like yung sinabi niya kanina, actually taga-Kalamba ako eh. Dito nakakatakot talaga kasi sobrang dami dito sa amin. Kami na yung number 1 dito. Pero yung gusto ko lang sabihin na we don't put our guards down kapag nakalabas na tayo sa hospital. Yun yung wag niyong kakalimutan kasi kahit paano sa hospital, nagdi-disinfect tayo, naka-PPE tayo. Kaya lang minsan ang feeling natin, pag umuwi na tayo, okay na. Di ba? Nagtatanggal. Alam nyo dito kaya marami nagkaroon kahit sa mga hospitals kasi uso sa kanila, pag nasa hospital, sobrang ingat. Pag uuwi na sa service or sa labas, kakain sila magkakasama, tapos puro selfie, kwentuhan. So nagkahawahan actually sa mga ilang hospitals dito. So yun lang, i-remind ko lang yun na pag kahit nasaan tayo, dapat lagi tayo mag-ingat. Lalo na siguro pag nasa labas din tayo ng hospital. Kasi sa hospital, alam pa natin na ang hahawakan natin may COVID. Mas maingat tayo. Pag nasa labas, hindi na natin alam, Doktora, di ba kung sinong meron? So mag-iingat tayo doon. Tapos, pwede ba akong mag-request na pabuksan lahat ng mga camera nyo kung nandyan kayo sa mga nagtatagong camera? Sir Andrew, pabuksan mo naman yung mga camera nila. Magpipicture lang ako.
Daw picture. Pag-picture daw tayo. Ano naman mga nakapunod?
Tago dun sa likod ng camera.
Ano ba pwede ba para?
Sige. Sa nurse station. Sige, malalaman ko kung sino yung nandito kasi pag hindi nagbukas, ibig sabihin wala dito. Okay. Sige, magpipicture lang ako. Bye! Post ko to Post. Yun pala, ayan, wala yung iba. Sige, smile. Post ko to Okay. Tapos yung sasabihin ko rin lang pala, I would also like to take this opportunity na lahat ng tao sa hospital gusto na, ayan, sarado sila kanina eh. Sorry, kuha pa uli Sige, isa pa. Lahat sa hospital gusto nating proteksyonan. So kung meron kayong mga concerns, sabihan nyo kami, sabihan nyo si Doktora, sabihan nyo ako, kunin nyo yung sarili kong phone number, pwede nyo ako i-message, pwede nyo i-message Sir Andrew. Kasi lahat tayo gusto natin proteksyonan yung bawat isa. Tapos yung mga concerns like for example, halimbawa paano kung nagkasakit ako or gusto kong magkasakit, pero ito naman din yung sasabihin ko. Kung yung mga ibang taong pumupunta sa ospital natin, tinatanggap natin, di ba? What more kung sarili nating kapamilya yung hindi natin tatanggapin? Parang imposible naman yon, di ba? Tapos meron din tayong mga, ano bang tawag doon, VTM, yung viral transport media. Meron din talaga tayo for healthcare worker. Kasi pag sinabi nating exposure, ano din lang tayo, di ba? Doktora, parang tanong ko na rin to sa'yo actually, parang question na rin. Di ba when you say exposure, kapag naka-complete kang PPE, tapos meron kang exposure sa patient, napaka-low risk exposure nun, di ba?
Yes, Doktora.
Compared
Ang
yes, Doktora. Question na rin yun.
Kung wala siyang PPE, tapos wala ding PPE si patient.
So kaya yun lang sasabihin ko. So remind nyo na din yung mga patients pag pagpasok kayo sa room. Hindi ko alam sa Bay, pero sa Kalamba, pag pumapasok kami sa room, kalimitan yung mga patients, hindi naman talaga sila nagsusuot, diba? So minsan tinatawagan namin, sinasabi ko sa nurse, tawagan nila para pagpapasok sila nakasuot. Hindi din tapos kayo nakasuot din ng PPE. So yun lang. So kaya alam ko yung risk mataas talaga yan dito eh. Kaya nga sabi ni Doktora, ang taas din ng mental stress. Totoo naman din yun kahit kanino sa atin. Basta remember lang, kaya tayo nagpo-provide ng PPE para protected kayo. Kung may mga butas pang ma-issue PPE, sabihan nyo kami Sorry yung before, sorry kung nagkaroon ng problema sa PPE, ako na yung humihingi ng sorry. Pero we will make sure na lahat ng PPE nyo maayos. Lahat yan subject to wear and tear. Hindi tayo parang abroad na gagamit tayo uli. Kung hindi natin yung gagawin, kawawa rin yung mga patients kasi sobrang laki ng i-charge sa kanila kapag ano. Pero nilalaban naman yun ng maayos saka dinidisinfect yun ng maayos. May padating din tayong apron pag naubos na yung plastic apron. So kinuha ko na rin tong opportunity na to para masabi yun, no? So sa akin ba may gusto kayong itanong or gusto kayong ireklamo? Anytime pwede rin naman. Pwede siguro tayo magpatawag ng separate kasi nakakaya naman kay doktora, sabihin niya, nakakaya naman kay
Ay, di
doktora.
doktora, okay lang po. Naka-limited na tong ano na to.
Okay. So
Zoom
kung
meeting.
may mga gusto kayong sabihin, pwede nyo ring iparating sa amin. So kung wala naman din kayong question, so again, I would like to express our gratitude, so the whole hospital, to Dr. Edel for accepting her position sa ICU and for giving this lecture. So, thank you very
Okay,
much.
so, and lastly, we would like to give or to award the certificate of appreciation to our speaker, to our lecturer. So, pakitapat na lang sa camera. So, before we award the certificate of appreciation, let me read the citation. Global Care Medical Center of GAINC Certificate of Appreciation. This certificate is awarded to Edelweiss M. Velasco, MD, in grateful acknowledgement of her distinct.
Sir Andrew, namute mo sarili mo.
Ay, oo nga, nawala si Sir Andrew. Ako nawala.
Pero,
Thank you.
ayan, picture na natin ah. Okay. Sir Andrew, na-mute mo yung sarili mo.
Oo nga, muted na po lahat.
Yes.
Sir Andrew, pa-unmute po nung ano ninyo.
Sir Andrew, na-mute mo yung sarili mo.
Yeah.
Ayun.
Ayan po. So, ayan po yung, binasa ko na po yung citation ng certificate. Now, Dr. Peras, award na po natin yung certificate kay Dr. Velasco.
Okay, let's give her a arm of applause.
Palakpakan naman natin.
Yeah. Thank you po.
Thank you, Dr. Maraming salamat po.
Oo.
Thank you, thank you.
Opo. Yung lecture po, ulitin ko po, isasend ko po yung soft copy kay Sir Andrew. Pwede niyo po siyang gamitin, pero bawal po i-reproduce sa iba kasi po ay hindi ko po siya pinagpaalam. Wala po siyang license to reproduce.
Apa.
Pwede lang gamitin among us. Yeah, pwede
For
po
internal
i-print,
use
pero hindi siya pwede ipamigay. No po, sa atin lang po. Okay po.
Apa.
And I will try kung na-record po yung lecture via YouTube, isasend ko po yung link sa inyo.
Apa. Thank you po, Dr. Thank you po sa inyong lahat.
Bye-bye po.
Bye-bye
May
po.
quiz tayo next week ha.
Yung nasa OD, picturean mo lang. Yan. Okay. Thank you, thank you.
Okay po.
Bye,
Thank you
Doktora.
po.
Bye. Thank you, Doktora. Thank you.